All right, this is going to be a gapping knee flexion technique. This is great for people who are dealing with knee pain when they specifically get into deep end range. So deep knee flexion, they have a sharp jab. Maybe it's a meniscal involvement. Maybe it's an inflammatory reaction. Whatever the case might be, this is going to be a great technique that safely gets you into end range flexion and allows a little bit more capsular stretching to give better information to the brain so that you can get more restoration back to full range of motion. So all we're going to do here is we're going to use a towel. You can see here I have a kid's towel, nothing fancy. Roll it up nice and tight, and then you're going to place it right into that knee joint. You got a couple different ways you can do this. So you want to make sure that towel's deep into the knee joint there. It's not really seated on the calf. You can start in a quadruped position. That's going to be hands and knees. And then all I'm going to do here is I'm going to rock back, sitting back towards my heels. When I do that, the towel is increasing the space into the knee joint, which is creating a little bit of a stretch. So I'm going to hold for a few seconds, and then I'm going to come back forward. I'll do this for about 10 reps. So if this isn't working, maybe the towel sliding out of the knee joint, maybe it just doesn't quite fit right, you can also do a kneeling position or a tall kneeling position. So all I'm going to do is I'm going to grab the edge of the towel, I'm going to pull it into the knee joint and hold it for support. Then all I'm going to do is I'm going to sit back towards my heel. Same deal, hold for a few seconds, 3 to 5 seconds, and then back up. You can sync this with the breath as well. So take a breath in, and as you sit back, exhale. And when you get to the end of the exhale, come back up, inhale, and then sit back towards your butt. Again, all we're doing here is that towel's helping to increase the space between the joint. So it's going to help with arthrokinematics. That is a natural alignment or natural movement of how the joint should move. This is restorative in the sense that if at a normal end range, like we get into a squat, we try to bend our knee without the towel, we feel a sharp jabbing sensation. It could be maybe the bones are rubbing on the bones, could be irritation or inflammation of the meniscus, whatever the case might be. All we're doing here is facilitating natural range of motion and natural joint congruency by just adding something as simple as a towel to increase the space in the joint to help restore that range of motion. So give this one a try. Again, this is a knee flexion gapping technique.